I'm Kalani from Mom and Natal, and today we're going to answer some of the top questions I get from pregnant moms and expectant dads about how having and taking care of a baby has just changed due to COVID-19. So joining me today, we have Dr. Colette Wiseman. Dr. Wiseman, thanks so much for joining us and helping us understand how coronavirus is really affecting parents, whether they're pregnant or in their postpartum mode. Dr. Wiseman, do you want to tell us a little bit more about you?
I actually grew up in Cleveland, Ohio, and I've lived in several other cities in the US, but you may hear a slight accent because I was born in England and lived there until I was 9. So if I talk a little funny, it's because of the different cities that I've lived in, different countries. And now I'm a practicing emergency medicine physician in Los Angeles, as well as being a mom to 2 children.
Got it. That's interesting. So what got you into the lactation side of things?
It definitely was having my first baby, which was during residency. And I, like most doctors and probably like most moms, figured, oh yeah, breastfeeding is best. Of course, I'll breastfeed. And then I started to realize I really didn't know much about the details of what that actually entails and how hard it can be. But things did work out okay for me. And then I started giving advice to other physician moms who are going through the same thing, and also felt like they didn't have really any training in what it actually takes to breastfeed, and answering basic questions. And then from there, I kind of moved on to advising private clients and just becoming more involved in the community in general.
Got it. That's great. And I know that you mentioned that you obviously were pregnant during residency. Mm-hmm. And obviously it looks like you're expecting now. So as that has changed and the change in procedures over that time period, what would you say that has changed the most, especially now during this time of the coronavirus and the pandemic?
Well, with the current pandemic, that brings in a whole lot of other factors. I mean, other than the actual logistical challenges of how do you go to see your doctor, who can come with you, how is delivery going to be in the hospital or wherever you're delivering, but also just the emotional anxiety. You have this whole new, I mean, pregnant women have a lot of anxieties to start with. It's totally normal. And now you have this whole other thing to worry about. How do you stay safe? How do you keep your family, your baby, your newborn safe? So it just brings up a lot of new questions that we don't even necessarily know all the answers to.
Right. And just so we know, I mean, with the coronavirus and it being so new, can you get a little bit more into what we currently know and how that's evolving? And especially how it relates to pregnant moms?
Yeah, at the beginning, we really didn't know very much. It didn't seem like there was a huge problem as far as pregnant women getting COVID, but we did know, especially in China early on, that there were some women pregnant and having been diagnosed with COVID. And so there was a lot of uncertainty. At this point, we kind of know that there's nothing major as far as transmission. If mom gets sick, we're not seeing, fortunately, huge numbers of baby injury or death or anything like that. But the caveat is that this pandemic has only been around 6, 7, 8 months, and pregnancy is 9 to 10 months. And so we don't have a lot of evidence about that first trimester and how it's affecting moms and babies if they're infected in the first trimester. So a lot of, in answer to your question, a lot of non-information. We do know from some good studies that have come out that pregnant women are at slightly higher risk of having severe disease if they get infected, meaning they're more likely to go to the ICU and have a breathing tube, but they're no more likely to have a higher risk of death. So that's some good news, some good, some bad. And as far as infants, we're not, again, seeing huge effects on infants if they do get infected, except if the infants do have other medical problems, and those ones are more at risk.
Yeah, it's really great to hear you say that. It's almost of a relief because you mentioned the non-information. I think we're getting bombarded with so many different information. One day it's this, and then it feels like the very next week the whole situation has changed. Protocols have been changing. So what's one way that you would recommend for pregnant parents or mothers to really stay on top of it and really understand what sort of information they should be paying attention to, and really what the trusted sources are and where they should be getting that information?
I think at this point we have, as pregnant women, we have to be as careful as possible. We don't know what effects there may be long term. We don't know what the major risk factors are, or maybe there'll be some additional risk factors we'll find out about later. So I think as much caution as is possible. Now, everyone's in a different situation. When I was about 5, 6, 7 months pregnant, that's when the pandemic started. And I was working as an ER doctor in several major Los Angeles hospitals. So I had to make a decision that, whether I was going to continue working. For me, I felt that I could keep safe. I understood there was a small risk, but I felt that I could keep safe and keep taking care of my patients. But other doctors may not feel that way. If women are able to stay home, great. Work from home if they're working. And if they're not, they have to discuss with their family and their social situation what's the best compromise for them.
Yeah, I mean, I think there's so many different factors that play into it, not only on a personal side, where it is what's, your relationship with your doctors, how you plan on delivering, what your family situation is, where you plan on delivering, but also the financial aspect of it.
Right. We don't always have a choice.
Yes.
And
so how would you say?
Sorry, I was going to say, in answer to your question about trusted sources, I would definitely recommend any woman's OBGYN, because they know the woman's previous history, risk factors, local risk factors, whether you're in a hotspot or not, and maybe can give them some advice on precautions that they can more easily take. So that would definitely be my first stop.
That's great. Yes. And as it relates to the other factors that play into this emotional side of things, when there are so many different factors at play, whether it's someone's family relationship or their relationship with their doctors or their past medical history, and also concerns that they might be having about delivery, how do you typically approach those clients that you're used to working with?
We go through what's known at this point and what are the well-known risk factors and the well-known precautions people can take, just reiterating the mask wearing, the social distancing. I think one very difficult thing is social distancing from family, when family may be pressuring people to attend family events, or once you've had the baby that the grandparents really want to see the baby, and to decide whether you're going to say no, if that's your personal comfort level.
Yeah. And when you talk about social distancing, you mentioned already the mask wearing, which I think we've all heard and kind of has become this hot button topic. Your kind of stance, as I understand it, is to be as safe as possible. So when it comes to mask wearing, what are the guidelines that you typically recommend? Is it when I'm at home? Is it when I'm out taking a walk? If I'm outdoors, what are the guidelines that you typically ask your clients?
So generally, if you're going to be within, 6 to 10 feet of others, if you're going to be indoors with others who don't live with you, such as a grocery store or a hospital, definitely a mask is great. You don't have to do an N95, a regular surgical mask, as we understand it right now, should be adequate protection, and to make sure the others around you are wearing a mask, because actually that's what protects you as a pregnant or as a person, the others around you wearing a mask. So to be insistent on that. Now, I think it's important to note that wearing a mask or having others wear a mask does not 100% prevent transmission of COVID. So again, minimizing the number of people you're in contact with is really important.
Great. Any other specific advice in terms of not just the emotional side of things, but also taking care of this new pregnant body that you have, that sometimes, especially for first-time moms, can feel new. So do you have any recommendations on how to really take care and nurture your body both before COVID and during COVID outside of the mask wearing?
Yeah, well, every pregnancy is different. And so it's important to realize that you may hear that your neighbor or your sister had a pregnancy and did this. They were running up until 39 weeks, or they were, they were in severe discomfort from early on. And to realize that it's really such an individual experience, and just to take any new symptoms as they come and discuss them with your doctor, with your family, and address them as you need to. Ideally, every pregnant woman would be exercising gently as much as possible, would be eating healthily, would be getting enough sleep, taking prenatal vitamins, and seeing their doctor regularly. Prenatal care is absolutely critical for finding any issues early on in pregnancy, whether it's with the baby or with the mom.
That's interesting. And for those prenatal visits, back when I was pregnant, obviously most of the things that happened, in person. But now, are there appointments that women should consider to have done virtually or via telemedicine appointments?
Well, I can't speak for all OBs, but I know my appointments have been moved to at least half being virtual. And they tell me as long as everything's okay, they're fine with doing a lot of the appointments as virtual. I think they've seen me about once a month since this started, whereas usually it would be every 2 weeks and every 1 week this late in pregnancy. But the remainder of the visits I'm still going to, they're just telehealth visits. And they've appreciated that I have a blood pressure cuff at home, so they can ask me, how's my blood pressure? I weigh myself so they can check that the growth is okay. So there is a lot that you can do over telemedicine.
Yeah, that's great to hear, because I imagine part of the anxiety comes from, traveling and leaving the home. So that's great that that's being offered. Yeah. Dr. Wiseman, I think there's also another section here that we wanted to talk about, which is, where are we? Recommendations to stay healthy. Oh, there's a big section on what women should do if they do contract COVID-19 or test positive. What happens if they feel that they have been exposed to COVID-19, and what they can really do if something were to happen or they feel that they were exposed.
During pregnancy?
Correct.
Yeah, so right now the recommendations are very similar to those of the general population. If you believe you've been exposed and the exposure was, say, without a mask and more than a few minutes and fairly close contact, you should be quarantining yourself for about 14 days. A lot of people are hoping that getting a test at some point would prove that they have not been exposed, they have not contracted COVID. But there is a fairly high false negative rate on these tests. So I don't necessarily think that you can 100% say that you're clear if you get a negative test, say a week or 10 days or 14 days after an exposure. So to be safe, it's a 14-day self-quarantine after you've been in contact with someone. And what's important to note is that that's if you are in contact with someone who has a confirmed case. It's not that you walked by your neighbor's dog and your neighbor's mother had COVID 2 weeks ago, but your neighbor feels fine. That's not considered an exposure. So it's not a second or third hand exposure. It has to be you to a positive person.
I think that's a really interesting note, because even for me, with my husband being here, he's out. And so if he has someone that he knows tested positive, what does that mean to me? So having those degrees of separation is really helpful. And what you're saying is it's a second hand, not a third hand or fourth hand, correct?
It is if you have direct contact. However, in your case, say your husband was in a meeting for an hour and they just weren't really wearing masks as much as they should, and they were inside, and then he comes home and finds out that person was exposed. Now, if he's living in the same household with you, probably all of you should be cautious. It's not enough for him to just stay home and then you can go out during that 14 days. So it's, every situation is just so unique and different as far as who's exposed, who you've been exposed to, how long it's been.
Yeah, I think we've all seen the stick figure diagrams and the videos and them trying to explain that, but we're like, there's so many questions. It's almost like it raises more questions than it answers because there's so many specifics that go into it.
Right.
So that's great. That's great to have some clarity on what that means. You mentioned the testing and the false negatives. We've also heard a lot about that when it came to antibody testing. Can you explain the difference between an active test versus an antibody test, how that might differ, and in which scenarios you would recommend someone get one versus the other?
Sure, the active test is usually positive during the actual illness. It actually detects the virus, whether it's the RNA or the actual virus particles. There's a number of different ways those tests can be done. Usually people have heard most about the nasal swab, the one that goes really far back and is really uncomfortable. And then the antibody test, antibodies to most diseases, your body doesn't produce notable levels of them, of the type we're testing for several weeks, really reliably. It varies in each person. And so it's not a reliable test of whether you're currently infected. And COVID seems to be a little different than some of the illnesses that have been studied. We're not sure that everyone is producing an antibody response afterwards. And we're not sure that how long antibodies protect you for. Does your body just make them for a month or two after, and then you could get COVID again? Do you make it for a year? Do you make it for 10 years? What level do you have? If you have a mild infection, you have a few antibodies, but perhaps we're seeing some studies to that effect. Is that truly enough to protect you from a secondary infection?
Yeah, sounds like there's lots of unknowns, and so added on top of all of the nuances that come with each situation really is something that's hard to get a handle on. You mentioned the antibodies, and I think originally when we talked about testing positive, that's from the pregnant side of things. How does that change once you've delivered your baby? The baby's home with you, and you think that there might have been an exposure, or a test comes back positive for someone in the household. What does that mean for you, and what does that mean for your baby?
Well, let's take the case where you as the mother develop a low fever or a cough, say a week after you had the baby, and you're thinking, oh, I was in a hospital, maybe I was exposed to someone, oh my gosh, what do I do? Number one, definitely to contact your doctor, probably at that point your OB or midwife or whoever was your provider during pregnancy, because you're still within that very close postpartum period. And there's, of course, other things that can cause fevers that close postpartum. There are different opinions from different societies on whether baby should be isolated from mom. More societies, and I personally feel baby should not be isolated from mom unless mom is too sick to take care of baby. The thinking is baby's probably already been exposed. There are also a lot of downsides to separating a newborn from a mom, and that's not to be taken lightly. Developmentally, for the emotional health of the mom, so also direct breastfeeding. A lot of people worry, oh, should I have baby actually touching my skin? Maybe it would be better if I pump and give someone else takes care of the baby in another room and just gives them a bottle. But several major societies are encouraging mom to continue to breastfeed if she chooses. If it makes her too anxious or would actually cause more distress, it's okay to separate. But if she would like to continue direct breastfeeding, a mask, good hand hygiene, obviously not coughing on the baby as much as possible, but to remember that number one, the baby has probably already been exposed to whatever she's got. And number two, hopefully some antibodies are being passed through in that breast milk.
Yeah, I think so much of the time we hear the benefits of breast milk and what it can do for the baby's immune system, but also, as you mentioned, for the mother's emotional health, chemicals and the hormones that get released during breastfeeding. I think as a new mom, there are always struggles. For me, when I was pregnant for my first child, it was a completely different breastfeeding experience than it was for my second child.
Mm-hmm.
As a new mom, I think the challenge is not knowing what's normal or what's expected. So during that time, and especially when everyone is isolating and socially distancing, what sort of support do you think that mothers should really focus on so that they can take care of their baby during that postpartum period?
Again, I think this is a personal decision, because ideally from a COVID perspective, you would isolate yourself and the baby in the bedroom and not come out for 6 months. But that's not feasible. And it is not reasonable either to ask anyone to do that. We all need support. The number one safest thing is online support. So whether it's you're doing your postnatal check-in with your provider online, or having an online lactation consultant, the pediatrician visit, even just maybe talking on the phone, realizing that most pediatricians will give you a phone call back if you have questions. You don't have to wait for an in-person visit. Online support groups for whatever issues you may be having as a new mom. Even just a new mom support group can be wonderful. So that's definitely something for people to set up and know about ahead of time. Just where am I going to get those resources? And then as far as having people in the house, if you need to have a night nurse or a postpartum doula, it's a personal decision. It's something that I am actually planning on having a little help during the daytime, a postpartum doula, just because I know that it will be really good for my emotional health and our family's emotional health. Maybe not as much as I would have prior to this.
Yeah.
And then having family support, again, talking with your family, your immediate family, before you have the baby, about what are we going to do about grandma? What are we going to do about the aunts and uncles and cousins and the little cousins, the ones who can't really control their coughing and sneezing and they don't wear masks, and coming to a family decision about what's right for you.
Yeah, I mean, I think there's also so much of that planning that has to happen before. And you mentioned that you were being induced on Friday.
Mm-hmm.
So I'm curious, when did you start that process of actually looking for those support and those resources for your postpartum care?
So I actually have a doula, and I started by looking for online doulas or virtual doulas who could potentially help me and my husband in the hospital. And that's actually changed to having her come in, because now in Los Angeles, you're only allowed one person, while my husband stays home and FaceTimes with the kids. So that was probably a couple of months, maybe month 7 or so, when you're really starting your 3rd trimester, thinking about, okay, this is really happening. How do I really feel about this? And then your own emotions a little better.
Yeah, and I think, for me, it was a matter of, I didn't know that a postpartum doula, I didn't know that was a thing. It was only after I had my second child that I discovered it and realized, wow, this would have been so helpful with my first, when I was going through some postpartum depression, and with my second, just navigating how do I deal with, raising a child and a newborn. So I think it's one of those great services, and having it be available virtually is also just, especially during this time period, can be so impactful. And it's one of those things where I lump it in as part of, that preparation that goes into having the baby. The same way that you set up the nursery, you're setting up your support system for you during this really important time period. And with the anxiety of COVID happening and not knowing how long that would last, I think that preparation is so important. So that's great. Going through the list. This one is really talking about labor and delivery, and it's under the part where we're talking about your rights in the hospital. Do you want to share what that means? And really, I think for some people, it becomes sort of this automatic process. You go in and you're just kind of told what to do. And I think it's really important for new mothers and pregnant mothers to really understand how birth plans can differ. And regardless of what the experience is and what the situation is, what rights you have as a patient when you're in that really important time.
No, I'd like to actually first address it as a healthcare professional, as a doctor coming from the other side, so that women can kind of see what our thought process is. We need to stay healthy and protect ourselves. So that's probably, so we can help all the patients. That's a big factor. Not that we're scared of our patients, but we want to make sure not to transmit disease between them, keep ourselves and our families healthy, because we know we are being exposed every day. When I finished working in the ER, my maternity leave started a little while ago, but I knew when I was in the ER that I was seeing positive patients up close every day. So we live with that realization. And that we're very much protecting our patients and protecting, in the case of newborns, protecting the baby. So that's kind of where we're coming from. And then from the mom's point of view, I think what's reasonable to expect now, knowing what the healthcare provider's goals are to keep everyone healthy, it's reasonable to expect that your nurses and any staff who come in your room will be wearing a mask. It's not because they think that you have an infection, but we just have to assume that for everybody. So that's good to know, that everyone wear a mask and possibly a face shield as well. And it's reasonable to expect that you will be asked to do a COVID test. This is something that you could potentially say no to if you're in your birthing time and you don't want to have that nasal swab. I don't know of anywhere that it's absolutely mandatory, but what they would do at that point is assume that you do have a positive test and continue to wear maximum protective equipment to protect you, other patients, themselves. But it is something, you don't have to have that test. They will ask you to wear a mask when they are in your room. It's reasonable to not wear a mask when nobody else is in your room except, say, you and your partner. So you shouldn't be expecting that you have to wear a mask the entire time. So those are kind of some of the precautions that should be expected in the hospital. The other big question that's come up is, say that quick test they do, turns out mom is positive. Now, whether you believe that's a false positive or you're worried that you do have COVID and you're terrified about transmitting it to your infant. Some societies are recommending separation, as I mentioned before, but you have the right to say no. There are no hospitals I know of that will force you to be separated from your infant.
Got it. And how would a patient know that? I think it's one of those things where you don't want to go too far down this path of what ifs, but I think it's a balance of preparing someone versus giving them like the information on being prepared, right? So it's scary stuff. And so knowing what those rights are and knowing what you have options for, are those the two main that you would really focus on, is the test and being separated from the baby?
Well, apart from all of the other things during pregnancy and delivery that you actually do have a choice on, which I think is probably a little too much to talk about in this brief interview, but you often do have a choice. And I, even as a doctor, didn't always know that. And what I found is the easiest thing, if you start thinking about it and wonder, wait, do I really need to have, 10 visits during this period? Even though they're scheduling them for me, it's really inconvenient this one week. And you just ask and say, oh, that week's not convenient. Could I come in early the next week? And something like that, they almost always say, oh yeah, sure. And so it's actually a lot easier response to get than you might think. You might feel it. So it's all about the mom feeling like she should say yes and just go along with everything. And they'll tell you, no, we need to see you every week because you have high blood pressure, or twice a week because you have high blood pressure. We really feel strongly about this. And then you've actually had a conversation and you understand why they're recommending what they do.
Yeah, I think it sounds like it comes back to that rapport with that with your physician, with your maybe even the support staff at your doctor's office, just building that rapport and making sure that if you are uncertain about something, that you are asking those questions and getting those answers that you're looking for.
Exactly. No, as physicians, we love it when patients are involved in their care and ask questions. We don't want them to just be doing exactly what we tell them. At least me and most of my colleagues feel that way, because then I know they're invested in their health. So if, for example, you want minimal testing, but you want to get the essential testing, you could tell your physician, but don't assume that they will remember 2 months from then. So if it comes up again, say, hey, I see that you ordered some blood tests for next week. I'm happy to get them if they are essential. Is there anything that we don't need to get at this point?
Great. All right.
Are there any specific questions you would advise your patients to ask once they get to the hospital?
Once they're actually in labor or at the hospital?
Yes.
It's difficult to, I mean, you could ask your provider probably prior to getting there, because honestly, in my experience, once you're there, you don't really feel like asking a lot of questions. So my advice would be, think about these things in the weeks and months prior and have that conversation with your doctor. And if there's something pressing that you weren't able to bring up, I would advise to discuss with your partner so that they can bring it up. Like if you're really wondering, oh, the guidelines, things got worse last week, are they now requiring I wear a mask the whole time, or what kind of mask do I need to wear while I'm pushing? Write it down, have your partner ask for you when you get to the hospital. As far as what kinds of questions, again, anything that's that last minute would probably be regarding to guidelines changing or hospital guidelines changing. And hopefully they would fill you in on that. But you could just have your partner ask, hey, has anything changed in the last 2 weeks as far as what you're doing at this hospital for women in labor and delivery?
And have you seen that start to stabilize as we've progressed? I know in the beginning it seemed very quickly changing and different for different hospitals. Are you seeing that that's starting to normalize or become standardized, or is it still very day by day?
What I'm seeing in the physician reports and kind of national news reports is that it varies a lot by region. And so in areas that are hard to hit, such as Los Angeles County, where I am, they did actually briefly become more liberal as far as delivery protocols, and then they stepped back again. We're seeing some establishment of women and patients' rights. So New York, I know early on in March, they were in a really bad situation. For a couple of hospitals said that women couldn't have any support people during delivery because they just wanted to absolutely minimize the number of people in the hospital. And what grew from that was women's rights when they're in the hospital, and they, within a few weeks, established that you should be able to have a birth partner even in the hardest hit areas. So I would expect things to potentially change. In some very some areas of very low cases, they're allowing multiple people to come to the hospital. So again, different from how Los Angeles is right now.
Yeah, and again, going back to patients' rights, is that something that you can do on your own behalf? So if for some reason I was pregnant and my hospital's protocol was that I need to deliver on my own and my husband cannot be there, do I have any rights to say, transfer me to another hospital so that my husband can be there? What sort of actions could I take in that scenario?
I think it's something you would need to discuss. I'm not sure it's even legal to transfer. I mean, you can always walk out of the hospital. You do, and we see that in the ER. People always have the right to leave, unless they're on some kind of medical protection for themselves. But I always tell my patients, I will offer you medical care. You have the right to go and seek it somewhere else, or to not do the things that I'm recommending. So certainly you would have the right to leave. Would you want to do that in the middle of delivery? Probably not. But if you found out a week ahead of time that your preferred hospital has a much stricter protocol than the one down the street, that would be a good time, and it's very important to you, then that would be a good time to look into switching hospitals.
Got it. Yeah, I think it's hard sometimes, especially to know, even delivery dates vary so widely. So I think what we're seeing now is just earlier preparation. Are you seeing that on your side as well?
Definitely. The people are trying to find out information. Information is changing. One website that I check frequently is the American College of Obstetrics and Gynecology, because they periodically put out new statements and recommendations for various guidelines for how things should go prenatally in the hospital. So that's a good source of the most up-to-date information. The CDC also has a website with information about pregnancy and infants. Now the two societies don't always match exactly, so that's another thing to keep in mind, that different societies have very slightly different guidelines.
Got it.
But I would encourage women to ask specifically, excuse me, do I have the right to decline this test? I would like to decline this test if possible, or I would like to, stay with my baby if possible. Do I have that option? And then the providers and nurses will tell you what your rights are at that moment.
Yeah. As a new mom, for me especially, it was knowing the exact words to say, because I felt like there was some secret code to get across what I wanted. So I think you just even putting it into words on this is the questions to ask is a great sort of way that we can share that out, because sometimes, the process is so new. We don't know really what's standard versus what is optional. So I think that's great. Just if you have any sort of hesitations or any concerns, asking those questions, doing it in this way, I think is helpful.
Yes, it's helpful to the doctors and nurses if you're very direct and just tell us what you mean and what you need. Don't beat around the bush.
Great. All right, is there anything else on this list that we wanted to talk through? I think, I know Dr. Wiseman, we also want to make sure that we have some video of you just saying how people can contact you, so that if they want to book sessions directly with you, and how you want to handle, this time period. So if it's videos or courses or pre-recorded things, I think if we can kind of capture that, because we know you're going to be busy starting next week or Friday.
Sure. I mean, everybody's situation is slightly different. Everyone lives with different people, has different concerns, has a different experience in pregnancy. And so it is a very customized kind of, or a tailored kind of question that people might have. So I'd be more than happy to discuss your particular situation and what questions you have, whether you've been exposed to someone with COVID, you think you might have been, you're concerned you will be, you're not sure. Even just the talking to friends and family can be helpful to think about ahead of time and discuss with someone. How will I tell my mom yes or no? What will I ask my mom to do in order to be around my family? So I could certainly do a session prenatally or postnatally and discuss with you and your family how to address those issues. And I will have had the additional experience within just a few days of having given birth in an area that's a hotspot for COVID and being in a hospital. And I think I will have even more insights after that, personally and professionally.
That's great. Is there anything that you would recommend for people to have ready for their session? I know obviously if you're postpartum, can my newborn also attend? What would that sort of experience look like? And what would you say that people should have prepared for that session?
I always like to get a good history. As a physician, that's just my background. I want to know, do you have medical issues? Did you have medical issues during pregnancy? How was your delivery, both emotionally and physically? So if people can give me information on that, that's really helpful. Was there something that was traumatic or not as you expected? that really plays into anxieties and even physical recovery.
That's great. And partners and children, are they allowed to attend as well?
I love it when partners show up. I always compliment the mom that what a wonderful partner she has, that I'm so happy they're involved. So that's always a big plus.
Yeah, I think getting everyone involved and having that circle of support is so important, especially during this time period. So that's great.
And I can also reassure moms that if they have a session virtually with me postpartum and they have their baby and their baby starts crying or needs to be fed, I completely understand. I'm very understanding of that. I've been through it myself twice. And so they shouldn't hesitate to talk to someone on a telehealth visit just because they're worried that their baby will cry. I know that was actually a big deal for me when I had my first. I felt I couldn't go anywhere because what if he cries and everyone thinks I'm a bad mom? So it's normal. It's completely normal.
And what about any special instructions on what they actually need to get started? Obviously, they'll visit the Mominatal website. What do they need, I guess, for that session?
Maybe just to write down some questions that they have, because as a new mom, you're a little sleep deprived, and often people will have questions afterwards that they wish that they had come up, although I'm usually pretty responsive to reply back if something comes up that they forgot to address. And yeah, just a little bit of the medical history details, and any specific questions that they really would like to get addressed. So if someone's interested in booking a session to discuss with me their coronavirus concerns regarding pregnancy and childbirth, or any breastfeeding questions, they just go to the Mominatal website, and then we can connect at your convenience. I have multiple schedule openings over Zoom, although I'm more than happy to do a regular phone call if you're more comfortable with that. Or we can set up FaceTime if that's technologically better for you. So very easy to set up.
Great.
Perfect.
I think, do you want to just close just with one final thought on what you would, recommend for pregnant mothers during this time period and how to deal with COVID, what that means to you?
Well, I would like everyone to focus on the fact that most pregnancies are completely healthy and normal, and you're most likely to have everything go smoothly with your pregnancy, with your delivery, with your newborn, and to try to not get too overwhelmed by everything else that's going on. Even in normal times without a pandemic, people have anxieties that what if this, what if that? And this is just one more thing, but 99% or more of pregnancies go very smoothly. And I would like women to remember that and feel confident that they will have a great pregnancy, delivery, and a wonderful infant.